one of the partners in the consortium that you just heard the results of the trial.
I mentioned that they have licensed the
that you have a woman coming into the clinic every month.
The data are significant. That's important. Number two, it fulfills an extraordinary need that we have that you've already heard described, and I don't need to repeat it for you. A need in the sense of science and public health and prevention, but also a need from a sociological standpoint for a group of people who for so long have had really very little opportunity to determine their own fate, namely women, particularly women in the developing world.
Network, or the Microbicide Trials Network, our role in this particular trial was one of helping in.
May or may not be, and they cannot get their partner to use it.
It can further reduce the likelihood of resistance.
Accumulates in plasma with multiple doses can be answered from the CONRAD phase 1 study that has been.
This study tested an antiretroviral product called tenofovir, and tenofovir was put into a gel like KY jelly and was put into an applicator. This is specifically for women to use in the genital tract. So we advised the women to use the gel up to 12 hours before they had sex or thought they were going to have sex, and up to 12 hours after they had sex, but not more than 2 of these gels applicators in a 24-hour period. To summarize, we had 30%, 39% less HIV, 54% if they used a lot of gel, 51% less genital herpes infection, and this was safe for use. Now, this is what's called a proof of concept study. That means this idea that you can put an antiretroviral into gel, women can use it as we advise them to use it, can work in preventing HIV, can work in preventing herpes.
This remarkable trial, and we'll plow on. Thanks again. Oh, let me say one thing. If there are any people in the audience who want to schedule individual interviews for any of the partners of the consortium, please see Manisha Bart.